So, today we're going to be talking about obsessive-compulsive disorder, OCD. We previously talked about ADHD, attention deficit hyperactivity disorder. So let's take a look at how a psychoanalytic Freudian might treat OCD. So a Freudian psychoanalytic analyst would approach obsessive-compulsive disorder by focusing on uncovering and resolving unconscious conflicts that are believed to be at the root of the symptoms. Unlike modern evidence-based treatments like cognitive behavioral therapy and exposure and response prevention, which focuses on managing and changing thousands of behaviors, Freudian psychoanalysis aims for deeper insight into the why behind the OCD. Here's a breakdown of how a Freudian analyst might treat OCD based on Freudian theory. Core Freudian concepts applied to OCD. Unresolved childhood conflicts. Freud believed that OCD stems from unresolved conflicts during the psychosexual stage of development, particularly the anal stage. This stage focused on toilet training and control and is thought to be where issues of control, orderliness, cleanliness, and defiance can become fixated. Repressed impulses. Obsessive thoughts are seen as symbolic representations of repressed, often taboo, sexual or aggressive, impulses from the id, the primitive instinctual part of the mind. These impulses are deemed unacceptable by the superego, the internalized moral compass. Defense mechanisms. Compulsions are viewed as defense mechanisms used by the ego, the mediator between the id and the superego, to ward off anxiety caused by these unconscious conflicts. The rituals provide temporary relief from the intense anxiety, even if they are illogical. For example, excessive hand washing might be a defense against unconscious feelings of dirtiness or guilt related to a repressed aggressive impulse. Symbolism. The content of obsessions and compulsions would be interpreted symbolically. The analyst would look for the hidden meaning behind the specific thoughts and behaviors. Treatment approach. A Freudian analyst would employ techniques such as free association. The patient would be encouraged to say whatever comes to mind without censorship. The analyst would listen for patterns, recurring themes, and slips of the tongue that might reveal unconscious thoughts and feelings related to the OCD. Dream analysis. Dreams are seen as the royal road to the unconscious. The analyst would help the patient explore the manifest or surface content of their dreams to uncover latent or hidden meanings related to their conflicts and symptoms. Interpretation. The analyst would offer interpretations of the patient's thoughts, feelings, behaviors, and dreams, linking them back to early childhood experiences and unconscious conflicts. The goal is to bring these repressed issues into conscious awareness. Transference. The analyst would pay close attention to the patient's relationship with them, as it is believed that patients unconsciously transfer feelings and patterns from past significant relationships, especially with parents, onto the analyst. Understanding these transference patterns can provide insights into the patient's internal world. And working through. This involves repeatedly examining and reevaluating the unconscious conflicts and their impact on the patient's life. The aim is not just intellectual understanding, but an emotional working through that leads to lasting change. Goals of Freudian treatment for OCD. The ultimate goal of Freudian psychoanalysis for OCD is not simply symptom reduction, but a deeper understanding of the underlying psychological dynamics. By gaining insight into the unconscious conflicts and repressed impulses, it is believed that patients can resolve these issues, leading to a reduction in their symptoms and a more integrated personality. Important considerations. It's important to note that classical Freudian psychoanalysis for OCD is a long-term intensive process, often involving multiple sessions per week over several years. While some studies suggest psychodynamic approaches may offer benefit for some individuals with OCD, particularly those who haven't responded to CBT, it is generally not considered a first-line or empirically supported treatment for OCD. Many modern mental health professionals, including those specializing in OCD, advise against traditional psychoanalysis for OCD, as it can sometimes lead to excessive rumination and may not effectively address the behavioral aspects of the disorder. Exposure and response prevention is widely recognized as the most effective treatment for OCD. So I hope you found this information on psychoanalysis, Freudian psychoanalysis, and OCD helpful. Let me know what your thoughts are in the comments, and I will speak to you next time.